Which of the following prevents coagulation? And let's go over just this ending here, preventing coagulation, because it's sort of a double negative. Because coagulation is blood clotting, forming together to prevent bleeding. But then when it says prevent, then it means the opposite. Preventing coagulation, so stopping blood clotting. So if blood clotting is stopping bleeding, but we're stopping blood clotting, we're sort of promoting bleeding. So promotes bleeding. And you might think, oh, this is such a bad thing. Why would we want to bleed? We don't want too much of anything in the body, because if we have too much clotting, then we could form clots where we don't want it. And that could cause things like strokes, because if we have a clot within the heart and then that clot moves throughout the body, it could go to the brain. So we don't want too much clotting, and we also don't want too much bleeding because we need circulation to survive. We don't want to keep bleeding profusely and losing blood. So you need that happy medium, which is why sometimes you need coagulation, but you don't want too much of it. As a side note, it's sort of, if you've heard of sort of the layman term blood thinner, like if you say someone's on aspirin, they're on a blood thinner, this is the layman term for an anticoagulant. So anticoagulant is really more the official term, because that means that we're anti, so against coagulation, clotting. So we're stopping clotting, which promotes more bleeding, which is why if somebody falls and hits their head, a lot of times they'll ask them in the hospital, are you on a blood thinner, an anticoagulant? Because if they are, then that's more of a concern for brain bleed. So just as an aside to help you understand what this question is asking you. So speaking of blood thinners, we know that there's one in particular called heparin, and you might hear of a lot of patients taking heparin to prevent clotting. So prevent clotting, maybe they have surgery or they have some sort of cardiac condition where we want to prevent clots in the body. And now one of these choices, the cell, actually naturally produces some levels of heparin within the body, which would prevent coagulation. Sort of like this blood thinner anticoagulant, and that would be your basophil. The basophils release heparin, which is why that would be the answer to this question. The lymphocytes and the eosinophils don't have that feature, and don't get confused when you see platelets, because platelets are the opposite. This causes clotting, and we want to choose the choice that prevents clotting. So therefore we would eliminate that if we're looking at that first. And we know between A, B, and C, the answer would be B, basophils, because this produces some levels of heparin, which we established over here prevents clotting, which is what this question is asking for, preventing coagulation, preventing clotting.